Welcome to the SkinCrest Clinic Dermatology Podcast. I am your host, Dr. Praveen Banodkar, consultant dermatologist practicing in Mumbai at SkinCrest Clinic. I thank you for joining today's podcast that covers everything related to skin, hair, and nails. In this episode, we would be discussing eczema, also known as dermatitis. Eczema is a non-contagious, inflammatory, dry skin condition that can affect people from early infancy to old age. The skin is often unbearably itchy. The urge to scratch can be irresistible. It can disturb sleep patterns, and it can flare up in certain periods of times which are unpredictable. The skin becomes red, cracked, sore, and raw, and patients are sometimes in extreme pain. Alongside these painful physical symptoms, children and adults suffering from eczema also have anxiety issues, depression, and they notice that whenever they are anxious, the itch in the eczema increases. They can also suffer from depression and other mental health problems. There are different types of eczemas ranging from atopic eczemas to contact eczemas, facial eczemas, the genital eczemas affecting either the male or the female genital areas, pompholyx or the small bubbles that you see on the hand, contact dermatitis, nummular or coin-shaped eczemas, seborrheic eczema or seborrheic dermatitis seen in adults as well as infants, and varicose eczemas. Many things in our environment can initiate an eczema flare-up. Some include clothing, diet, household irritants, swimming, sun exposures, friction of even shaving, and cold weather. Keeping the skin moisturized using emollients or medical moisturizers is a key to managing all types of eczemas. There is a difference between the regular over-the-counter moisturizers and the medical moisturizers that dermatologists write. Topical steroids are the first-line treatment to bring the flare-ups of eczema under control, and many other treatments including systemic medications like immunosuppressives, antihistamines to control the itching are available to control severe symptoms. Always visit your dermatologist for the prescription of steroids and immunosuppressives. Topical steroids have their own list of side effects, and the use needs to be monitored by the dermatologist. In today's episode, I would like to focus on the use of moisturizers in eczema. Eczema is a very individual condition, and the treatment needs to be tailored depending on the type of symptoms. Different emollients suit different people. The best emollient is the one that suits the patient the best. You need to use different types of emollients on different parts of the body to obtain the best hydration levels and to restore the skin's barrier functions to normality. You may also like to alternate between emollients in different seasons and different environments, from warmer to the humid monsoons to the winter seasons. You should use your emollient frequently. You should leave your emollient or emollient soap substitute that you wash with instead of soap or shower gel, which can dry out the skin further. While COVID-19 remains a threat, we recommend people to use soap and water to wash their hands and to use an emollient every time after they wash their hands. Apply emollient gently in a single direction. Do not use a lot of friction or rubbing action on the area. Protect your hands with emollients before handling substances like sand, certain foods, paint, clay, so that do not irritate your skin. A very commonly used thing in the household is cooking oil or coconut oil that can be applied before handling irritant substances. Avoid putting hands into the pots or jars of the cream. Use a spoon to remove them out from the jars to prevent contamination. Carry a small container of emollient with you whenever you are outside, and continue to use the emollient even after the eczema improves. Apply the emollient to all of your skin, not only the area where you have the eczema. You should store your emollient at a room temperature, preferably wrapped up in a cloth. You can store it in a cool area. Do not put the ointment in the fridge. Hope you all enjoyed listening and gathered some valuable take-home messages in today's discussions. Looking forward to connect with you all again. Thanks for tuning in. For dermatology appointments, you can send a WhatsApp on 9867 955 944. Take care, stay safe, and stay healthy.